Hey guys, this is Alyssa, and this is my discussion response for P2 discussion 7. After reading the scenario about the open cut in the stomach with a knife, we answer some questions. Number 1, what should Rachel and Damon do next? They've already ensured that the scene is safe. When they got there, it was secured by law enforcement, and the officer motions for them to proceed. Next, they need to make sure to take body substance isolation measures and ensure that they have the appropriate PPE on. And then, although they can see an obvious traumatic wound to the abdomen, they need to complete their primary survey and not get distracted by the obvious wound. This would include checking for X, A, B, C, D, E. Starting with X, they need to check for any exsanguating hemorrhage and stop it if present. If the patient loses all their blood while they're checking airway, breathing, and circulation, then their body won't be able to oxygenate at all. Even if you get airway and breathing done, if they have no blood left, that's not going to help them. Next is A for airway. They need to ensure the patient has a patent and protected airway. Then they need to check B for breathing to make sure the patient's ventilations are adequate and unlabored. Then C, they need to check the patient's circulatory. They need to make sure they're circulating well by checking pulses, central and peripheral, and skin condition like color, temperature, and dampness. Then they need to check D for disability and deformities. Then this can include checking GCS and AFPU and look for any injuries that are causing a deformity. Then E for exposure and environment. They should expose the injury while maintaining as much privacy as possible for the patient so that they can assess it better and protect the patient from environmental conditions and hypothermia. While someone is doing the X, A, B, C, D, E, the other person can be checking vitals and asking the patient sample and OPQRST questions. This should be done early on in case the patient loses consciousness later, so that the crew can be aware of pertinent information about the patient that could help the receiving facility with continuation of care. They should also be performing a rapid assessment for signs of shock or internal bleeding. Then it says the patient removes his jacket, the paramedics see protruding bowel. So number 2, what is the name of this kind of penetrating injury? What are the paramedics' immediate concerns? What is the most common protruding viscera? This particular penetrating injury is known as an abdominal evisceration, since there is an abdominal organ protruding outside of the patient's body through an open wound in the abdominal wall. Some of the paramedics' immediate concerns should include severe internal bleeding, hypovolemic shock, infection, or contamination of the exposed organs, damage to other internal organs, pain management, and patient deterioration. The most common protruding viscera is the small intestine. Number 3, how should Rachel and Damon conduct an assessment of this patient? Since the patient has a penetrating trauma to the abdomen, this patient should be treated as a high-priority trauma patient. This means that the paramedics need to perform a rapid trauma assessment and rapidly transport the patient to an appropriate trauma center. This should be more of a load-and-go type of situation since the patient needs immediate surgery. The only things that should happen on scene would be finding and taking care of immediate life threats and stabilizing the patient for transport. Then it says during the assessment, the patient tries to push the bowel back through the wound. Number 4, how should the paramedics manage this patient? Should they replace the bowel? The paramedics should not attempt to replace the bowel. Pushing the bowel back into the abdomen can cause further damage, contamination, or compromised blood flow. Proper management would include covering the exposed organs with sterile dressings, moistened with sterile saline, placing a sterile occlusive dressing loosely over the area, keeping the organs warm and moist, position the patient supine with knees slightly flexed, if tolerated, to reduce abdominal tension. Administer oxygen, treat for shock, establish IV access, manage pain, reassess every 5 minutes, and rapidly transport to a trauma center.